Good afternoon and welcome to the COVID-19 media briefing on April 14th. First up, we have Mayor Tory. Go ahead, Mayor.
Well, good afternoon. More than 800,000 COVID-19 vaccine doses have now been administered in the City of Toronto. We are the first health region anywhere in Canada to administer more than 800,000 doses. Vancouver, for example, has administered more than 270,000 doses, while Montreal has done more than 567,000 doses. But we still have much more to get done. I am determined with my colleagues to make sure that we continue to vaccinate as many residents as supply allows, and I'm determined, just as I know Prime Minister Trudeau and Premier Ford are, to get more and more vaccine supply. I'm heartened by the fact that our clinics are operating at full capacity relative to the supply that we have. That means people have answered the call to sign up for their vaccines, which was a challenge for us earlier on. Thank you to everyone who has signed up and to everyone who has helped others to sign up, and let's keep going. We do know that our clinics can vaccinate more people if we have more supply. So we're working to secure that supply from the other governments so that we can get more residents vaccinated as quickly as possible. And we do know that many of our hospital partners who use Moderna in their clinics didn't receive a shipment this week. The shortage of Moderna is very frustrating. We all want everyone vaccinating as many people as possible non-stop. We're also advocating for them to get additional vaccine supply now. That means advocating on behalf of the hospitals as well, and in the future from the province, who, as you know, receives its supply from the Government of Canada. That's why earlier this week, the GTHA mayors and chairs from the 10 biggest municipalities in this entire region called for more vaccine doses for hotspot areas. Public Health, working with Ontario Health and hospital partners, has compiled a list of more than 1,200 locations for pop-up and mobile clinics. And that includes places like seniors' buildings, shelters, and other areas in hotspots that we know can provide access to vaccine doses. Nearly 239 locations on that list have been done already, largely by our hospital partners. And the work is underway, subject to vaccine supply, to get to as many of these locations as possible. Today, for example, Unity Health Toronto has deployed mobile teams to a Toronto community housing building, to St. Jude's Community Homes, and to the Good Shepherd drop-in program in hotspot neighborhoods. They plan to vaccinate approximately 140 residents age 18 and older. As we have said, city-run mobile clinics will also be up and running in some of these hotspot locations, adding to the ongoing efforts of hospitals in mobile and pop-up settings. Toronto Public Health has assembled a team of up to 30 staff to support outreach mobile clinics, and we're starting with a clinic next week in one of the hottest hotspots in the northwest of the city. Toronto Public Health is responsible for the logistics of vaccine supply, IT, and administering vaccines. The community partner in question in each of these areas will be responsible for community engagement and providing ancillary supports to these pop-up and mobile clinics, things like translation services and line management. Planning is still actively underway on this, and we will be working to get more details directly to the community so that people will know the wheres and the whens of these pop-up and mobile clinics operated by Toronto Public Health, which, as I said, will supplement the ones already being done and going forward will be done by the hospitals. We are doing everything we can as a city to get people vaccinated. Today, we're announcing the Toronto Accessibility Task Force for COVID-19 vaccines, which has been created to serve our community of people with disabilities. This collaboration between the city and community partners has begun making recommendations to immediately reduce the number of cases within this community and address issues surrounding accessibility. People with disabilities are a high-risk group when it comes to COVID-19. And so it is essential to provide accurate information and easy access to vaccinations for them. Wendy Porch, Executive Director at the Centre for Independent Living in Toronto, is chairing this task force. Within days of making recommendations at their first meeting, which was held in late March, 200 people with disabilities were vaccinated thanks to the collaborative efforts by the task force and by our health partners. The task force and the good work it will do is part of Toronto's COVID-19 immunization outreach efforts, and the TO supports Targeted Equity Action Plan. That work has also led to a town hall about vaccines that I am having tonight with faith leaders from across the city. This is one of many discussions I plan to have with faith leaders to help to make sure that they have everything they need in order to help members of their respective faith communities to get out and to get vaccinated. It is one more way that we are reaching out as a city, and I am happy to be a part of this effort personally. We know that vaccines alone will not stop the third wave. It will take this provincial shutdown that we're unfortunately experiencing right now. It will take keeping our distance from each other and absolutely avoiding socializing with people that we don't live with. Right now, we all have to keep following the public health advice to get through this wave, and in very short order, I hope, get to the point where enough residents are vaccinated that we can really start to put this pandemic behind us. Thank you to everyone who is continuing to follow the public health advice to help save lives and to protect our healthcare system. We are working to make sure that we keep giving people places to go outside safely and to get some fresh air and exercise during these tough times. I know last year many people who enjoyed High Park on a daily basis were upset to see the park closed during the cherry blossom blooming period. This year, we have worked with public health, with our park staff, with Toronto Police, and with the bylaw officers to try to find a way to keep the park open safely so that people can use it while still avoiding having the large crowd scenes that the cherry blossoms would attract in a normal year. And this is certainly not a normal year. This year, High Park, I'm pleased to say, will remain open throughout the spring. People will be able to walk or run or bike through the park, but we are encouraging people not to flock to the park to see the cherry blossoms. The best way to see the cherry blossoms, as was the case last year, again this year, will be from your own home. People will be able to watch the bloom from home on the Blossom camera, the city's most popular live stream. 200,000 people tuned in to the Blossom camera live stream last year. We're bringing it back so that people can watch the trees 24/7 if they want during the peak bloom. We want people to enjoy the blossoms virtually and safely. And we still want people to enjoy the park. We developed our Blossom health protection arrangements this year with a real focus on health and safety and preserving access to the park for people who need to be outside in that park. Staff are working to install fencing in High Park around the 3 largest collections of cherry trees to discourage people from gathering to see the blossoms. Parks and other city staff will be on the site to continuously monitor what is going on and make sure that those measures are successful in avoiding crowd scenes, in allowing people to continue to use the park, and still allowing people to look at the blossoms virtually from home. We will restrict access to only limited areas of the park. It's now my pleasure to introduce Chief Pegg to give his report for today.
Thank you, Mayor Tory. Good afternoon. As of Monday morning this week, all 9 city-operated COVID-19 vaccine clinics are operating 7 days per week, with appointments available between 11 a.m. and 8 p.m. daily. All 9 clinics continue to operate efficiently and smoothly, with each clinic being fully booked on a daily basis. Wait times for those who arrive shortly before their scheduled appointment are short, with most people not having to wait at all. In fact, the majority of people are checked in, vaccinated, and checked out of the clinic in about 30 minutes. The number of appointments that are made available in city-operated vaccine clinics corresponds directly with the number of doses of vaccine that are available to be administered. At present, we are able to administer 56,322 doses of vaccine each week across the network of city-operated clinics. Assuming that vaccine availability increases in the future, as the province forecasts that it will, we look forward to being able to administer more than 122,000 doses each week in our city-operated vaccine clinics. We intentionally scale our clinic operations in order to protect vaccine allotment for our hospital and Ontario Health Team partners as well, such that their clinic operations are able to continue to the largest extent possible. At present, city-operated vaccine clinics administer Pfizer vaccine. We only order the actual number of doses of Pfizer vaccine that are required for clinic operations each week. Any unallocated doses of Pfizer vaccine that are not used in city-operated clinics as a result of missed or canceled appointments are provided directly to our Team Toronto Hospital and healthcare partners. We receive shipments of Pfizer vaccine from the province of Ontario on a weekly basis. The most recent shipment of Pfizer vaccine was received on April 12th. That vaccine shipment contained the amount of vaccine required to operate our city-operated clinics for the next 7 days. Accordingly, at present, the total quantity of vaccine in our freezer is equal to the amount of vaccine required to operate our city-operated clinics until end of clinic operations on Monday, April 19th. The next shipment of Pfizer vaccine is scheduled to arrive in the afternoon of April 19th, which will provide us with the amount of vaccine required for the next 7 days of operation. In summary, we do not stockpile vaccine. The only vaccine that is held in our freezers is the vaccine required to operate the fully booked, city-operated vaccine clinics between the date of delivery and the next Pfizer delivery date, which occur 7 days apart. Vaccines that are allocated to our Team Toronto hospital partners are shipped directly to the respective hospitals by the province of Ontario. This is comprised largely of Moderna vaccine. It is our understanding that the shipment of Moderna vaccine, originally scheduled to arrive on April 19th, is now expected to arrive on April 29th. AstraZeneca vaccine is provided directly to pharmacy and primary care physician partners directly by the province of Ontario. The demand for vaccine appointments in our city-operated clinics continues to be very high. All 9 of our city-operated clinics are fully booked for the next 7 days. As of 7 o'clock this morning, the first available appointment in a city-operated clinic is on April 21st. As of this morning, both our Scarborough Town Centre and Malvern Community Recreation Centre clinic locations are now fully booked through May 9th. To date, we have administered 30,762 doses of vaccine through the Scarborough Town Centre Clinic and a further 10,725 doses of vaccine through the Malvern Community Recreation Centre Clinic. We anticipate being able to open the next block of appointment dates within the provincial booking system next week. Our immunization task force continues to be focused on vaccinating as many people as possible, as quickly as possible. This is a goal supported by our Team Toronto partners, including the City of Toronto, Ontario health teams, hospitals, pharmacies, and primary care physicians, all of whom are working in collaboration to maximize vaccine rollout across Toronto, including supporting mobile clinics as part of Phase 2. Again, as vaccine availability increases, there will be a corresponding increase in the number of partner-operated vaccine clinics, as well as the number of mobile and pop-up clinics that are able to be operated across the city. In accordance with the vaccine eligibility requirements established by the Province of Ontario, the following groups of people are able to book their vaccine appointment in a city-operated vaccine clinic via the provincial booking system. Anyone 60 years of age or older on a city-wide basis, and anyone 50 years of age or older who lives in a designated hotspot neighborhood. Of course, anyone who is 55 years of age or older is also eligible to receive vaccine in a pharmacy. Other opportunities may also be available in hospital and Ontario Health Team partner clinics. Recently, the Province of Ontario announced that residents who are 18 years of age or older and who live in hotspot neighborhoods in Toronto are able to receive vaccine in location-specific mobile or pop-up vaccine clinics in hotspot areas as they occur. Generally speaking, vaccine appointments in mobile and pop-up vaccine clinics are not booked in advance. While each specific situation is unique, it is common for these hotspot mobile and pop-up clinics to be operated on a walk-up basis, with eligible adults coming from the very specific location that is being served. For example, residents of a specific building or complex located in a hotspot neighborhood would be directly notified of an upcoming pop-up clinic in that building or complex, along with the relevant information as to how and when to receive vaccine in their upcoming clinic. In summary and in general terms, residents don't travel to a mobile or pop-up vaccine clinic. Rather, mobile or pop-up clinics come to a specific group of residents in a specifically prioritized hotspot location as vaccine availability permits. Further information as to current opportunities to receive COVID-19 vaccine can be obtained at toronto.ca/COVID-19, as well as through our Team Toronto Hospital and Ontario Health Team Partner website at vaccineto.ca. Eligible residents can book their vaccine appointment in city-operated clinics by accessing the online provincial booking system at toronto.ca/COVID-19 or via the provincial call center at 1-888-999-6488. I continue to ask you not to contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you. I will now invite Dr. de Villa to provide her report for today.
Thank you, Chief Pegg, and good afternoon. Today I'm reporting 1,332 cases of COVID-19. There are 90 new hospitalizations to report, bringing the number of people in hospital to 730. 124 of them are in the ICU. As I said on Monday, we are living through one of the worst periods of the pandemic, and the demands on our healthcare partners are unprecedented. I'm sorry to report the loss of 8 more lives to COVID-19. The growth of cases screened positive for variants continues. Today, the total number of variant cases is 12,152, almost all of which are the variant B117. Vaccine supply for Toronto is presenting a challenge at present. The volumes we need are arriving at a slower and less predictable rate than we had expected, impacting clinics across the system. Appointment booking this week and inquiries about the mobile and pop-up clinics in the hotspot areas suggests that people are eager to be vaccinated. And this is great news. The challenge is supply and the need that creates in getting all those who want to be vaccinated as quickly as possible. Delivering at current levels of vaccination, or better yet, reaching our maximum capacity to vaccinate, will require more vaccine than is in the pipeline at present and delivered on a more reliable basis. Vaccines are in high demand and unpredictable in supply across the country. I appreciate how hard the province is trying to deliver the allocations it receives from the federal government, and I am certain that all parties are focused on solving the problem. Even if vaccine supplies were not an issue, each of us needs to do our part. It's as important as ever that we all follow the steps for self-protection and abide by the stay-at-home order to the maximum extent that we can. Physically depriving the virus of the ability to spread is our most powerful tool until such time as vaccinations reach a level in the population where they provide a strong firewall against COVID-19. Above all, stay confident that we will get there. There may be bumps in the road, but at the end of the day, everyone who wants to be vaccinated will be vaccinated. I also expect today that there is bound to be some unease for some people around vaccines, now that Canada has reported a first blood clot event connected to the AstraZeneca vaccine. A Quebec woman is reported to be recovering at home, having experienced a blood clot within 2 weeks of receiving the AstraZeneca vaccine. It is the first event of its kind in Canada, where we have administered about 700,000 AstraZeneca doses. In the United States, health authorities are reviewing the Johnson & Johnson vaccine after 6 people who had received it developed rare blood clots. In total, more than 7 million people have received the Johnson & Johnson vaccine in the United States, which means that these events are extremely rare. A review is being done in Europe, and Health Canada is reviewing the development as well. The risk of developing a blood clot associated with the Johnson & Johnson vaccine is estimated presently at about 1 in 1 million doses. By any scientific definition, this is a very rare risk. But for most people, it's information overload out there, and often information that's more alarming than reassuring. So I want to reassure you. News about the vaccines emerges frequently. There's a lot of information available on the internet, and some very unqualified vaccine skeptics sowing fear and misinformation through social media. Given all the stress and uncertainty we've been living with over the past year, it's sometimes difficult to know what to believe. Vaccine is a medical intervention, so having questions is understandable. Wanting more information is normal. Let me put into context the odds and risks of developing blood clots associated with vaccine and try to put that 1 in a million figure in some perspective. I found a table of risks in a publication for physicians that helps to illustrate the point, and I chose 1 practical example of health risk and 2 that probably seem to most of us as pretty unlikely to happen. So, the chance of any of us dying in any accident at home in the next year is 1 in 7,100. The chance of being hit in your home by a crashing airplane is 1 in 250,000. The chance of drowning in the bath in the next year is calculated at 1 in 685,000. And as I said before, the current estimated risk from blood clots associated with the Johnson & Johnson vaccine is 1 in 1 million. Most importantly, though, the events of the last 24 hours show us that all the systems are working to assure safety in vaccines and to thoroughly investigate and understand any adverse events. For the Johnson & Johnson vaccine, reason has emerged to take a pause and assess, and that is what is being done. You can have confidence that the agencies responsible for assuring your safety are taking that responsibility seriously, and that if a vaccine is available to you, it is safe for you. With that, I'll now hand it over to Lavin for the question and answer period.
Thank you, Dr. de Villa, Mayor Tory, and Chief Pegg. We'll now begin the Q&A from the media. As a reminder, it's one question, one follow-up, and when we call your name, please unmute yourself. We do also have staff on the line if you do have any technical questions. First up, we have Brian Passafume from the Toronto Sun. Go ahead, Brian.
Good afternoon, everybody. Yesterday, Mayor Watson in Ottawa called for an 8 p.m. curfew in city parks in response to large gatherings over the weekend. Toronto's seeing similar crowds over the weekend, and as the city slowly emerges from winter into spring, is this something that's being considered here?
I can say that the answer to that question is no. We discussed what happened in Ottawa. We discussed more particularly what happened in the parks over the weekend. And while there were some parks that were well used, we did not identify anything that led us to conclude that would be the best answer to deal with it in any event. We are going to be proceeding, weather permitting, to put some of the circles in at least the one park at Trinity Bellwoods to help people to keep themselves distant. But there is no discussion at this moment in time of that kind of a measure being undertaken in this city.
Okay, thank you. Second question. What Chief Pegg mentioned, he said that the city has enough, if I understand it right, enough vaccine supply to last until the end of day Monday, with the next shipment expected for Monday afternoon. If that delivery doesn't arrive as hoped, what's going to happen? Will sudden last-minute clinic closures on Tuesday be something that we should prepare for?
Hi, good afternoon, Brian. So we scale our clinics and we book appointments based on the delivery timelines provided to us by the province. And we are all provincially operating on I suppose you could refer to it as a just-in-time delivery process that's coming from the feds, the Government of Canada via the province, and then of course to us. So we are expecting that shipment. There's no indication that there are any issues with it. To answer your question directly, if that shipment were to be delayed, yes, we would have to respond to that and look at how we would adjust clinic or adjust the distribution of vaccine, and that could potentially affect booked appointments. But I will reiterate, I don't see any risk for that at all. There's no indication that there's any risk. And I will say, Brian, that this is the delivery system that we have been operating on throughout. We are directly connected with the province consistently with respect to the supply chain and delivery. And I have every confidence that if there were any possibilities relating to that, we would be advised in due course.
Thank you, Brian. Next up, we have Matt Bingley from Global News. Go ahead, Matt.
Hi, good afternoon. Dr. de Villa, just in case you haven't seen the photos circulating on social media, they're showing once again very crowded buses of people heading into work, and it's just being told by people as we were speaking to them that this is a very common thing in the morning, especially in the Northwest. I know that during the first wave, bus crowding wasn't seen as serious because of the short times that people were on board, but because variants are now involved, how safe is it for passengers and drivers to be crammed into that tight bus space for really any period of time for an average drive?
So, Matt, thanks for the question. It's difficult to provide an exact characterization of risk, but certainly we know that distance does make a difference and ventilation makes a difference. So given that the weather is a little bit better, certainly opening up windows on the buses will help, and obviously maintaining distance to the greatest extent possible and using a well-fitting mask are going to be important components of measures for self-protection. I, of course, am more than happy to speak to our colleagues at the Toronto Transit Commission to see what might be done. I know we've had conversations over the course of the entire pandemic. They too are interested in, of course, providing good service, which includes as safe a possible service for all their transit users. So we'll be sure to take that offline and try to provide the best environment possible. But I can't emphasize enough, where possible, for those who can work from home, obviously that's the best thing going, right? The stay-at-home order means stay at home to the greatest extent possible. I recognize that there are workers for whom that's not a possibility. And so to the extent that hours might be shifted to allow for travel at less busy times, that's also another strategy over and above maintaining distance and wearing a well-fitting mask.
May I just add to that? I had a meeting with TTC CEO Rick Leary on Monday, and we pursued this matter again at that time, as we do on a very regular basis, more than weekly. And he reassured me again that there have been substantial number of buses reassigned from all parts of the city to service some of these busier routes, that we have even retrained some streetcar and other operators to be bus drivers so that they could drive the extra buses on those routes, and that for the vast majority of the day, in the vast majority of places, the buses are at a capacity level that allows for distancing that would be desirable. I think the doctor's idea about opening windows and so on is a good one in any event, now that the weather is better, but I take this up with Mr. Leary on a regular basis, and I know he and the TTC executives are looking at this every single day, looking at detailed measurements of the different bus routes and doing the very, very best we can in terms of reallocating buses to the places where they're most needed.
And to follow up on, well, cherry blossoms, Mayor Tory, I'm just wondering, obviously there was a lot of backlash last year about fencing off the entire park. This year, can you just elaborate a little bit more on exactly what you're doing around the trees? You're fencing them off, and do you think that'll be enough? Because, last year we saw, people jumping the fences to drink around the trees. What do you say to people who say that this is still kind of overkill?
The number of people who jumped the fence and were drinking and doing various other things last year was very tiny, and that the park was closed. We're hopeful that this year there'll be nobody who will choose to do that. We're going to fence off the 3 areas of most concentrated cherry trees. And, we have to rely on people at some point in time to understand that if they want to have the ability to use the park, to have a walk or to have a cycle in order to be outside in the fresh air, and as people want to do at this time, they're going to have to follow the very clear parameters that will be set out by this fencing. We will be monitoring it continuously, and we will do whatever we have to do on the advice of Toronto Public Health, and we've talked to them about this plan. We will do whatever we have to do to maintain public health. But I'm very confident that the people, after all this time and all the misery we've been through, will be able to watch the blossoms on the camera, and will be able to enjoy the park at the same time, and that we will not have issues, but fingers crossed.
Thanks, Matt. Next up, we have Dave Woodard from Global News. Go ahead, Dave.
Good afternoon, Dr. de Villa. I spoke with someone today who couldn't get an appointment in their region to get vaccinated, despite having a high-risk health condition. So they booked an appointment out of region where there's apparently a surplus. How safe is it for people to go elsewhere to get a vaccination shot? And can you stop people from leaving Toronto to get one, or for that matter, stop people from coming here to get vaccinated?
So Dave, when it comes to the vaccination system, particularly the provincial booking system, it is, again, just that. It's a provincial system. So for people who are using and seeking appointments through clinics that are making use of that provincial booking system, while it will direct you first to clinics, to vaccination clinics that are closest to your own home address, it does allow for booking across the entire province. So people are open and have the opportunity to book at the clinic that they're willing to go and travel to. Obviously, given that we are under a stay-at-home order, the idea is for people to stay at home as much as possible. But we are, of course, interested in seeing people obtain their vaccine as soon as their term comes up, as soon as their eligibility arises. So obviously, probably best as much as possible to stick as close to home as possible. I think that's the intent of the stay-at-home order, in order to reduce interactions between people that you don't live with. However, if that's what's necessary in order to get vaccine, and it is a very straightforward go to get your vaccine and then come straight home, you can imagine that the risks are pretty reduced there. And it would be a good thing for people to get vaccine as quickly as possible. Obviously, best if it can be done close to home, but recognize that the entire provincial system is just that. It is a provincial system.
So just to follow up then, Dr. de Villa, are you suggesting that if somebody can't get vaccinated in their region, that they should be going elsewhere just to make sure that they do get vaccinated?
You know, I think, Dave, people have to make their own decisions around their health care. And in fact, we see this not only with vaccine, we see this with health care across the board. People often live on the border of one jurisdiction and the next, and sometimes the closest healthcare clinic is actually one that is technically outside of the jurisdiction in which they live. I think we have to trust that people are making good choices and taking advantage of vaccine as their turn comes up to receive the vaccine. But of course, we're also really encouraging people and hoping that people do respect that stay-at-home order and abide by it to the maximum extent possible, recognizing that getting necessary health care would be one exception.
Thanks, Dave. Next up, we have Francine Copin from the Toronto Star. Go ahead.
Oh, hi. My question is for Dr. de Villa, and it comes from somebody who's working in the hospital slash clinic, vaccination clinics. And her question is, why aren't you allocating more of the vaccine supply to the hardest hit spots in Toronto? And why did you open the North Toronto clinic when hospital clinics are closing?
So, Francine, in fact, we're working together with our hospital partners. You'll have heard Chief Pegg make in his remarks comments around Team Toronto. That is Toronto Public Health and the city, in partnership with hospitals and the Ontario Health teams, all of whom are working together to provide vaccine to people all over the city. So we have actually pooled our efforts together and are following that provincial prioritization framework, which has seen us start off, for example, with long-term care and retirement homes, and we're now working through the prioritization framework. And we have committed to work together to providing vaccines as quickly as possible and in collaboration with each other to those hardest hit areas of the city, regardless of where the hospital partners are situated. As you can well imagine, most hospital clinics are used to providing service to their catchment area, which tends to be fairly local. But given the circumstances and given the very tight vaccine supply, we have all agreed that we should work together, provide vaccines through mass immunization clinics and encourage, and through mobiles and pop-ups, that we will all do together with a particular focus on those areas of the city that have been hardest hit, especially as hotspot areas have now come to the fore and are now part of the current prioritization phase within which we find ourselves right now. So we're all working together to try to get vaccines to those to those areas of the city where we know those vaccine resources can give us the most value, first and foremost for the individuals in that area, but beyond that to the rest of the city as well.
I think the argument would be that maybe that's what's supposed to happen, but that's not in fact what's happening if hospitals and clinics in hotspots don't have the vaccine supply and the mass immunization clinics do. I think that's the argument.
Well, I think when we look at where our clinics are located, in fact, a number of them are located specifically in those very hard-hit neighborhoods. We have two very active and busy clinics, for example, in Scarborough, and as well, a very active several mass immunization clinics towards the north and west ends of the city. So I think we have really worked very hard to ensure that we're making mass immunization clinics available. I think fundamentally what we have here, though, is an issue of supply. As Chief Pegg has provided, we are only, stocking our clinics with just enough vaccine to see us through until the next delivery. And I think we are all suffering as a result of a delay in arrival of vaccine. There were vaccines that were anticipated to arrive on a certain date. Unfortunately, that date was missed. And as a result, we have a crunch on vaccine availability. I think the good news here is that there's interest in our population in receiving vaccine. And it's our most fervent wish to be able to provide those vaccines to individuals who want that vaccine as soon as is possible. And I think the mayor has something he'd like to add.
Francine, I just want to add to that simply this. I can assure you that the mayors, the other governments, all of us on Team Toronto are working together, us with the hospitals, to actually focus on the question of, without minimizing any of the problems that have arisen in the system, making the pie bigger, as opposed to trying to focus on the sizes of each piece of pie. We've got to have a bigger pie, and we're all very focused on that and working very well together to try to do whatever we can to get more supply for the City of Toronto and other hotspot areas, but for the City of Toronto, so that we can address all of these needs that exist, especially in the hotspot areas.
Thank you, Francine. Next up, we have Mike Walker from CTV. Go ahead, Mike.
Thank you for taking my questions. This is for Chief Pegg. Just following up on the rollout to vaccinate homebound individuals, specifically seniors. Spoke with one woman today whose father is in his 90s, has registered, but they still don't have any timelines yet. Just inquiring if you can provide some insight why some individuals who are considered a priority and are homebound are still left waiting for confirmation, and what has been done so far in terms of the homebound vaccine rollout.
Thanks, Mike. I would say first and foremost, these are top priorities for us all, and we are. I think the previous the discussion to Francine's questions really are germane to this as well. What is limiting all of us is the availability of vaccine, and we are active. We have a number of mobile teams in place. We had an update from Chief McEachern, the Chief of Toronto Paramedic Services, at our immunization task force recently, where I'm going off memory, but I believe it's around 900, sorry. Around 900 homebound folks have already been vaccinated through that program. And we acknowledge we are not done yet. We have a long way to go. But we're making the best effort that we can make. We are deploying all of the resources that we can deploy, which is constrained by the availability of vaccine. So we will continue to do the very best we can do, and the moment that additional vaccine is available, we will increase those efforts, increase our efforts in immunization clinics, and I'm confident that so will all of our Team Toronto partners, be them hospital, be them Ontario Health teams, be them mobile and pop-up clinics. So I certainly appreciate the concern. I wish that were not the case. I wish nothing more. I wish we had all this unlimited supply of vaccine sitting in a freezer somewhere where we could go and access it and make sure that everyone had access to their vaccine today. Unfortunately, that's not our reality. We'll keep doing everything we can do until it is.
Just so you know, Mike, and it's useful for people out there to know that these arrangements are made through community care agencies that serve people in their homes, people who are homebound. And so our wonderful partners in the EMS, and Chief McEachern's done a great job on this, plus the UHN hospital, have been having webinars, for example, for the community care agencies, so they know how to help the homebound seniors or homebound people to get registered. And also we've had a wonderful response from groups of nurses and registered nurse practitioners who want to come and help with this. And so we're now mobilizing all those people. But as Chief Pegg said, supply is going to be the one thing that's going to determine all of this, but we're getting more and more resources that we're able to apply to this in terms of people to do the immunizing and people to inform the community care agencies, so that the people who are eligible for this program will know how to access it, and then we can get on with actually doing more than the 900 that have already been done, and we're keeping at it.
I'm just hoping maybe you can clarify this then. I was chatting with Dr. Samir Sinha this morning, who said the main problem he believes is manpower, appreciating that it takes time to do this, and there's only so many paramedics that can do this on top of their other duties, and that he believed that vaccine supply was not the issue. So, hoping if you can clarify that. And as you alluded to, Mayor, are there any other plans to ramp up these efforts to bring other resources on board? Thank you.
Maybe I'll just start, and just because I put it at the end of the sentence or an answer I gave a moment ago. There are groups of other emergency responders, nurse practitioners, nurses, and even physicians who've come forward to say they would like to help in this effort, because it's very much a one-by-one thing. You're going to somebody's house and actually immunizing them at home. And so as those people have come forward, you obviously have to train them as to how this program works, which we're in the process of doing now. And there have been 900 done even without a lot of those resources being deployed, mainly by our paramedics. So we will continue to ramp up those efforts? And the answer is yes, we will be doing as much as we can. But again, you know, supply is an issue for the entire program, as you've seen, from the hospitals all the way through and including this. And if we have the supply, of course, there'll be more done because we now have more people that are being mobilized to do it.
Thanks, Mike. And last question is Derek Dionneran from CBC News. Go ahead.
Thanks for taking the time to answer these questions. My first question is for Mayor Tory and Dr. de Villa. We're hearing from employers and employees from facilities located in hotspot areas who feel they should qualify for vaccines, even if they don't necessarily live in these hotspots. Right now, aside from the mobile clinics going to some workplaces, it's only those who live in those hotspot areas who can get a shot. Would you endorse the province allowing people who work but don't necessarily live in hotspots to be eligible for vaccines, and how likely is that to happen, do you think?
So, Derek, right now we are following, as we have throughout the entire course of the vaccination campaign, the provincial prioritization framework. And as such, we have just started with those who live in hotspot areas. The one exception being teachers who live or work in hotspot areas, at least in Toronto and Peel. What we are doing in respect of workplace specifically, outside of focusing on those hotspot areas where we know a goodly number of essential workers actually live. So by focusing on those areas, we are able to get essential workers and their entire households covered, given the current format of the hotspot strategy. But looking specifically at workplaces, the Toronto vaccination partners have agreed to pilot some workplace clinics to determine and evaluate, what benefit further can be provided by looking specifically or putting workplace vaccination clinics in site. And to assess and evaluate and make a determination as to whether that's worth scaling up further or whether, in fact, it is better to continue on with the current hotspot strategy or whether it might be a little combination of the two. So do stay tuned. We are trying all kinds of ideas to see, which ideas actually deliver the most value with our current resources. But of course, as the Mayor and the Chief have indicated right now, the issue is around supply. When supply is tight, it's difficult to, expand activities. And of course, we're looking forward to seeing supply challenges resolved so that we can get as many people who are interested in receiving those vaccines in their arms in the fastest way possible.
And just to follow up, switching gears a little bit, 18 shelters are in outbreak, not including the Novotel and 45 Esplanade. Why is the number so high? Have residents with confirmed cases of COVID-19 been required to shelter in place because of the city's isolation centers being a little bit full at times?
So just a couple of things. I think that first, let's look at the definition of outbreak. When it comes to an outbreak, we're talking about 2 or more cases. So it can be as few as 2 cases to declare an outbreak, but it has to have a link to the specific place. And in this case, we're talking about a shelter. So again, each outbreak is a little bit different, but the outbreak is declared when we have as few as 2 cases or more consistent, in a particular time period associated with that particular facility. I think the other thing that's important here is that we're talking about what is happening in our community. And what we are seeing in our community is the proliferation of these variants of concern, notably that B117 variant. And what we found is that this B117 variant is incredibly transmissible and much more transmittable from one person to another compared to the previous variant of COVID that was circulating before. This is an experience that has been seen the world over. Every other place in the world that has dealt with B117 has had that same experience, much more transmissible than the forms of COVID-19 virus that were circulating, say, at the end of last year. So with more transmissibility, it just means that it's easier to spread from one person to the next. That will be especially true within an indoor environment. So I think we're seeing a reflection of the nature of the virus, the nature of the B117 variant, and those are the circumstances that our colleagues are working with as they're out there, on the front line, seeking to provide good service within the shelters.
That's it for today, everybody. Thank you for joining us today. The next COVID-19 media briefing will be April 19th. Have a great day. Thanks.